Hi, my name is Lisa Uren, and I'm a mental health advocate for NAMI Solano County. May is Mental Health Awareness Month, and the week of May 2nd to May 9th is especially the week for tardive dyskinesia. Tardive dyskinesia is a serious side effect of people who take antipsychotic medication. Dyskinesia means abnormal and uncontrollable movements, and tardive means delayed onset. Most people do not have symptoms of tardive dyskinesia until long after beginning this antipsychotic. The prevalence rate is 3% of those who take antipsychotics. The symptoms of tardive dyskinesia include face grimacing, tongue thrusting, and fish-like facial expressions. It can also manifest as rapid jerky movements in the arms, torso, and legs, as well as slow writhing movements in the arms, torso, and legs. The symptoms can be very troubling for the patient and for the family. The constant contortions of the face can cause raw tissue inside the mouth, inside the cheeks and lips, and the constant movement causes the mouth to produce excessive saliva, which can cause drooling, which is an embarrassing symptom of TD. When I was first diagnosed with TD, I went to my neurologist and she had me produce a video of my symptoms so that we could follow a progress chart of how the treatment was working. I would like to show you that video now so that you can see in real life what the symptoms of tardive dyskinesia look like.
Um, do you know what? Could you tell me your name?
Lisa Uren,
Okay, and then what is the date today?
February 19th, 2019.
Okay, and then could you tell me about the movements that you get?
I mostly get in the morning. I don't get the excessive salivation, but I do get the tongue undulating, and I do get the pursing lips. And then as the day goes on, around noon or 1, I start getting the excessive salivation. And it seems to have moved from both sides in the last couple of weeks to just the right side and the front part.
Okay.
So I'm puckering and sucking to clear both of that side and the front part.
So now just relax and don't try and suppress the movements. Let them happen the way they, involuntarily happen.
My story started with tardive dyskinesia about 3 years ago. I developed it about 7 months after I started taking Haldol, which worked well for my psychotic symptoms. However, I then began having what seemed to be jaw clenching problems, but it turned into tongue thrusting and cheek sucking. Again, as I mentioned before, my mouth became raw and my mouth produced excessive saliva, which required me to swallow every 30 seconds or so. It was quite an odd sight to see me doing those activities. Needless to say, it was very difficult to eat with a raw mouth and raw and swollen lips, which were also cracked due to excessive wetness. Of course, this added to my depression and isolation. I did not want to go out in public. I didn't want to go to meetings or have any sort of presentations, because even when I was speaking, you could tell that I was not in control of my mouth. It added to my stigma of my mental health. And in fact, it caused me to gain 60 pounds over the 2 years that I had TD, because I was A, stress eating, and B, trying to eat to ameliorate the symptoms of the TD. The condition is also exhausting because you're moving your mouth constantly all day, depleting that energy, and your subconscious is trying to stop those movements. And so basically your brain is battling your body. And by the time I got to the end of the day, I was so excited to go to bed because I didn't have the symptoms when I was asleep. And obviously it's an embarrassing symptom. It's a bit like Parkinson's disease. It's been compared to that. And it's embarrassing to sit in a waiting room or at a presentation or even at a lunch with friends and have your face making these involuntary movements because it seems like you should be able to stop them. Unfortunately, that is not the case with tardive dyskinesia. There's not a lot of treatment for tardive dyskinesia. It's important if you start developing symptoms to talk to your doctor to make sure that you can change doses, change medications, see if you really need to be on the medication. There's also Botox therapy, which is what I had, where they injected Botox in my jaw to try and make those muscles of my jaw that were contorting relax. But I think the most important treatment is therapy because it takes such an emotional toll on you. I hope this has been helpful information for you and your family, whether you're deciding whether to start an antipsychotic drug or whether you've started to develop symptoms. You can find more information at www.nami.org. Thank you.